Thank you, Mr. Chair, to inquire.
Proceed.
Thank you. Thank you, Doctor, for being here. Appreciate the opportunity to have a 3-minute conversation with you anyway. So you use the term gender-affirming care. So I'm going to ask you, would you consider surgery gender-affirming care?
For someone who wants it, who's of age, it is gender-affirming care.
So it is gender-affirming care if it's someone that is at least 18 years old?
It would be gender-affirming care if you weren't 18 years old, if you fit the definition of gender dysphoria and you met the eligibility and readiness criteria as outlined by the Endocrine Society guidelines.
So 13-year-old girl, 16-year-old girl wants a double mastectomy. She meets the particular guidelines you're talking about. You would
not meet the guidelines. That's not in the recommendations that a 13-year-old would get that surgery.
Well, okay, so have you ever, do you know of anyone under 18 getting that kind of surgery? Any kind of surgery that would?
I know of 17-year-olds having mastectomy, but I do not know of any individuals having genital surgery under 18.
So you know of no one having genital surgery under 18. You know of 17-year-olds that have had mastectomies.
Correct.
Would you call that gender-affirming care?
As outlined by the Endocrine Society guidelines, yes.
So it is. So in your view, it is.
The guidelines say that down to potentially age 16 for double mastectomy could be considered in certain instances. But the recommendations in general say 18 and over is recommended.
Wow. Another question for you, doctor. Can cross-sex hormones cause sterility?
That's a lengthy question. In some individuals, the answer is yes. In other individuals, the answer would be probably not.
So it's possible.
It's possible.
It's possible that
Yes, it
these
is.
drugs could
And by these
prohibit an
drugs,
individual from being able to have a
by these
family.
drugs, which drugs are you referring to? I want to make sure we're on the same
Cross-sex
page.
hormones.
Correct. Yes.
Okay, they can cause sterility. Okay. But knowing that, you have no problem with children being exposed to cross-sex hormones. Is that correct? Is that a fair characterization?
I think what you need to understand is that each individual is decided on a case-by-case basis. There's no blanket recommendations. And I actually always tell people, I'm not here to recommend that you do medication. I'm here to talk about options, and you and your parents and your mental health providers need to decide what are the best options for you.
But exposing an underage child to drugs that could render them sterile is an option that is on the table, in your view?
Yes.
Thank you for
You're welcome.
the inquiry.